So that was a little more than 3 minutes. So I'm taking you to about 20 degrees now. And then I spring you, and I can still get that forward thrust and normal recoil. So let's have you walk down the hall. And then come back and sit in the chair. So what's walking feel like?
Well, it's kind of like with my foot a while ago. It just feels more loose. I don't feel like I'm bracing myself the whole time.
And where do you feel loose?
In my hips.
In your hips. Excellent. I want you to just go halfway down and come back.
Okay.
And I want you to pay attention to the weight bearing on your feet.
Yeah, I really wasn't paying attention to that, but usually the outsides of my shoes wear down.
Correct.
In about half the normal time that they should. But I feel like I'm kind of sitting flat. My feet are kind of
I agree.
even on the floor.
You're putting more weight bearing. You're pronating more. And pronation is normal. There is such a thing called hyperpronation, which may be an individual variation, or sometimes it can be pathological, but people really like to medicalize that. But with you, your body let me work with it and restore your normal amount of pronation that you should have. Maximize that mid stance. So when you're weight bearing on your left foot and your right foot is propelling forward, that's where you should have maximal pronation. Onward until you put the right heel on the ground. Okay? And now you have that. And so now every time you walk, your hip and your pelvis, your lumbar spine, your ankle, your midfoot, is all finding that normal range of motion, so it reinforces my treatment.
Yeah, what's interesting right now is before we started this, my low back, I was in constant pain sitting in this chair, or in the other chair.
Okay.
And it's gone right now.
I was waiting for that.
Yeah.
Okay.
Yeah, the low back was just a constant sharp, kind of between sharp and dull all the time.
Yes. Yeah.
And I didn't notice it till I sat down the second time.
Okay. There's one more thing I'd like you to comment on. So walk halfway down the hall and back and just see if you're aware of anything else in your body. I don't want to prejudice you. Your thoughts? What do you think?
It's my headache.
Say what?
The headache is gone.
The headache is gone.
Yeah.
That's what I was chasing. Okay? You now have greater rotation in your upper neck.
Yeah, that's 24/7.
Is that right?
Yeah.
Okay. All right. Well, because your hips were so tight and because your tali were stuck forward, then we know that your upper cervical, the atlantoaxial joint, was hyperextended, driven by muscle, driven by the righting reflex. And you can't overcome a reflex. I could treat your neck all day long for months. And, you know, well, you're a little better, keep coming, right? But instead, we treated the cause. Now, I will look at the rest of your body. I will screen your upper neck and see if there's anything I need to do to help it coax along. But again, my intervention is a one-time gig. It's a different model, and it's not a good business model. But yes, your upper neck has greater mobility. Go ahead and look over your left and right shoulder. And we didn't test it before, but what's your general impression?
Well, I have pain when I get to here,
Okay.
but before, I mean, it's constant.
Okay.
So,
Alrighty.
yeah, I feel different already just with what you've already done.
Okay.
Especially the headache is major. I mean, for me to not have a throbbing headache all the time is a big deal.
Wonderful. So tomorrow I'll teach you how to keep this motion, how to reinforce it.
Okay.
Sometimes you don't have to, again, because your body finds that movement every time you walk. But I just want you to be confident, and I want you to test it once a week. And the self-treatment is very, very simple. So we'll just make sure you are independent of me.
Cool.
All right? Excellent. Thank you.